Today we're going to talk about pain reprocessing therapy, something that comes up a lot, as well as CBT when we look at chronic pain. Often, pain reprocessing therapy looks at our thoughts and feelings that get in the way of our pain because pain and fear contradict each other. If I feel the pain and then I think of, oh my goodness, migraine's getting worse, won't be able to cook dinner, that fear is going to get in the way and then it's going to make the pain worse. And however your condition is, it might get affected differently. And that's normal. But constantly being on high alert is a great strategy to avoid lines if you're a deep breath. But in the modern world, excessive fear can make life harder to survive. So, where does it all come from? In stressful situations, early life stress, and big changes, good or bad, can bring these pain cycles into our lives. And all these and more put brain on high alert. And certain behaviors can too. There are three habits that we see again and again in patients with chronic pain. Often worrying is a big one. Worrying increases feelings of danger and it keeps our brains spiraling in a state of high alert. Putting pressure on yourself is another big one. Have to, I need to, I should. These are all self judgments and they come with shame and guilt and they weigh on us. Pressure triggers the need for vigilance and is associated with a state of fear. If I have pressure on myself, I might push myself through the pain and then feel it later. And it'll keep me crashing in that triggered cycle. Self criticism is another one. And often you'll ignore your achievements or things you were able to do and focus on that mistake you made or that mistake you said in a conversation. Criticism activates that brain's threat system now. And so our brain is always in a state of threat. Looking at what did we do wrong? How can we fix it next time? Did they notice it? And those kind of things keep our pain high and keep our pain cycling. So those are just a couple of things we look at in pain reprocessing therapy.